Many of the symptoms of this recently described syndrome resemble those of a rare childhood illness called Kawasaki disease. Kawasaki disease itself is a clinical diagnosis. There's no single lab test, we understand, which can detect it, and the cause is unknown. The U.S. Centers for Disease Control and Prevention in Atlanta is preparing to release an alert warning doctors to be on the lookout for symptoms of this very dangerous inflammatory syndrome in children. And joining me now to discuss the matter further is Pediatrician Dr. Candice Jones, who is in Orlando. Dr. Jones, welcome, and thank you for joining the program tonight.
Thank you for having me.
Can you give us any more of an indication as to the possible links between COVID-19 and this syndrome that we're talking about?
Yes, so pediatric multisystem inflammatory syndrome is a new illness. It just started popping up around the end of March here in the U.S., and most of the cases characterized around April and across Europe and in the United States. So this is still very new, and what that means is that we don't know much about it. We do think it is linked to COVID-19, but as we know, even the CDC doctors across the nation are still trying to figure this out and treat this. So we will know more information as time goes on.
And from what we understand out of New York, the victims, the young victims that have been treated, and unfortunately 3 of them, I guess at my last count, whose lives have been lost, were COVID-19 positive at some point before contracting this. Is that correct?
Most of these cases, there's a little over 100 cases now with the 3 deaths, like you said. Most of these cases did test positive for COVID or were found to have antibodies for COVID-19. Not all of them, but most of them. So that leads us to believe that it is related in some way. And then also, we believe that it's due to an overwhelming inflammatory reaction, the immune system responding to the infection after the fact. So there may be a delayed response. The child may have even been asymptomatic, and then a week or 2 or more later, they have this condition, and then we have to backpedal and figure it out.
And I'm also wondering about, we do have some states where children are actually going back to school now. There are plans on reopening the country, as we've been discussing. How concerned are you that this is a syndrome that, as you said, we don't know much about, with children returning back to school and being around other children, and then possibly taking something home with them as well?
Right. So first, I would say that children, although they have been spared up until this point with COVID-19, we have always known and have always said that kids can get COVID-19 just like adults, okay? Now, with this condition, I just want to set people's mind at ease. There is good news. This is rare. There's been 100 cases. It's still rare, so don't panic. We just want people to be aware and know the symptoms in case your child has them, so that you can get them into their doctor, to the hospital right away, because this is treatable. Most of the kids are recovering. And that's the point that you need to be worried about, not worry so much about this new illness.
And Dr. Jones, before we let you go, could you just review for us quickly what parents or adults ought to be looking for in children? How does this present?
So the symptoms include prolonged fever, 4 or 5 days or longer. The children could have abdominal pain, vomiting, even diarrhea. And then this inflammatory type process probably mostly just shows up, once they're investigated in the hospital. But it can, as you mentioned before, affect the heart. The patient can appear to be going into shock where they're not responding or taking in fluids, dehydration type symptoms, so in a rash as well. So if any of these things start to happen, just call your doctor, call your hospital, and get right in to be investigated.
All right, Dr. Candice Jones, thank you so much for lending your expertise to the program. You're welcome here anytime. Please take care of yourself and be safe.
You too. Thanks for having me.